You know those days when the paperwork just piles up?
Simple Practice is the EHR that makes it all easier. Scheduling, billing, treatment plans, even notes. No wonder over 225,000 practitioners trust it. Check them out at simplepractice.com.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt with Katie Vernoy, and this is the podcast for therapists about the things that go on in our professions, the things that happen that affect us, and I got to be in my bonnet. This is enough to where we are throwing in a whole extra episode because we recognize that the California BBS is putting out a public comment period on some proposed regulation changes, and there's some stuff in there that's concerning to me. Now, if you're not in California, this still is an episode that you should listen to. This has the potential for looking at some of the echo effects that this can have across the country. This is something where you might also just learn kind of how we think about things and how it ends up affecting our profession. So we're talking about this California proposal. We'll include a link to it in our show notes over at mtsgpodcast.com. But it's not just Katie and me talking. We brought along our good friend, Dr. Ben Caldwell. He attends a lot of the California BBS meetings. He is incredibly knowledgeable about how all of these processes work, and he's just a good guy to hang around with. So thank you very much for joining us, Ben.
Well, thank you for having me. It's always good to talk with you both.
Yeah, I was just laughing because you were shaking your head about the knowledgeable part. You are very knowledgeable, and it's always fun talking with you. You're quite the smarty pants. But before we jump into our conversation, we want you to answer the question that we've had you answer like 4 or 5 times, maybe more than that in the past. But who are you, and what are you putting out into the world?
I'm Ben Caldwell. I'm a licensed MFT in California, and I'm the president of High Pass Education, which does continuing education courses and exam prep, along with other resources for clinicians.
As many public boards do, as many organizations do, when they are coming up with some ideas about changing the laws, in this case, or changing the regulations, how a board's going to implement things, most public boards do a very good job of putting out a public comment period. And this allows for people who are not necessarily able to attend the board meetings or engage in a lot of the committee discussions that goes into making stuff, for the public to be able to actually say, hey, have you considered this? Have you considered how this might actually be implemented? It's something that I think is a wonderful part of being in a democratic society that allows for lots of people to do this. And there will be a call to action for California therapists at the urging of Curt and Katie, and by extension, Ben, in his participation in this episode, to talk about some of the concerns in the most recent proposal and public comment period. This comment period ends January 20th, 2026. So there is a little bit of time for you to do this. We will also make available the comments that we are going to be talking about in this episode. So that way you have at least a starting point to be able to send this in. And lastly, they have to at least acknowledge response of comments that are brought in at some point or another, whether they accept them or not. I think my record is I had 3 comments rejected at one meeting at some point in the past. So
Why do comments get rejected? I don't understand that.
Sometimes they just say, we've already considered this and we disagree with you. Sometimes they don't agree with my reasoning. Sometimes I think they just want to get rid of me. So,
well, all that stuff may well be true, but I will point out here that it's also the case that in any public comment period where they have to acknowledge all the comments that have come in and provide some kind of a response to every comment, there tend to be at least a few where the response from the board is, you know what, you're right. We hadn't thought about that, or we hadn't thought about that in quite that way. And so we're proposing to adjust the language of this proposal on the basis of this public feedback. And that's the whole reason why they do the public comment period.
Who are the people on the board? Let's just give for folks who are really naive to this process, who are the people on the board? Who are the folks that are going to make this decision?
That's a great question. So the BBS is, if I'm remembering correctly, currently a 15-member board, of which half minus one, so 7, are licensees themselves. 2 MFTs, 2 clinical social workers, 2 professional clinical counselors, and an LEP. And the other 8, so a slight majority, are what are considered public members, meaning that they are not licensees themselves. They are appointed through either the governor's office or the legislature, with the idea being that the board is a public protection agency, so it should be mostly the public who is represented there. That way you can avoid the board being sort of captured by professionals who might act out of self-interest. Also, let me just step back a second. I had the math wrong. The board is 13 members. It's still half minus 1 licensees. But I forgot that right now there's only 1 LPCC member of the board. So it's 6 licensees, 7 public members.
Okay, so that's who we're talking to. Why are we concerned? What's going on in this proposal?
I will kind of go from the top down there's a couple of proposals here. I'm going to start at one. And I think the very first one is an incredibly easy suggestion because it is kind of odd. And the oddity in this one to me is in the licensing process, the California BBS utilizes a vendor named Person View to implement their testing process. And I find it incredibly odd that they are codifying that Pearson View is needing to be part of the regulation listed here rather than simply stating it's a vendor. Somehow, in my line of thinking, this locks in that this is going to be a forever vendor, a private entity that is not run by the California government and therefore should not be listed by name.
Totally agree with that. It's just an odd choice. It's okay to put in regulation. We need to include in some forms the name of the vendor, how to contact them, et cetera. It is unusual to list a vendor by name, because what happens then if you change the contract, right? It becomes somebody else, then your regulations become out of line with what you're actually doing, and that can become problematic for other reasons.
So why would that happen, the Person View thing? That sounds like lobbying by a particular private company. I mean, this seems weird.
Oh, I don't think it's that. I don't think it is. Pearson View is not showing up at board meetings trying to get themselves locked into regulation wherever they possibly can. They're a vendor. They want the board's business. I think this is more just a matter of the board trying to codify what they are already doing in practice. That's not nefarious. It's just, I think, an oversight. I don't think they're intending to lock in Pearson View as the forever vendor. I don't think Pearson View is lobbying for this. I think this is most simply a mistake.
Okay. So we just need to point that out so that folks recognize that when you put stuff into law, it ties your hands unless you've created the intent, not the outcome.
Correct.
Okay.
And this is seemingly pretty minor and not the bulk of this episode here, but this is one of the very simple things that people in the public pick up on that say, hey, rather than listing this vendor by name, why not just change the language to the testing vendor? So that way, if the vendor ever changes, you don't have to go in and change the law.
Yeah.
And this would be something that I could see the board taking feedback like that, especially if it comes from the millions of listeners that could potentially take action from this episode to flood the email inboxes at the California BBS to say, you know what, maybe we should do this.
Sounds right.
There's a lot in this pending legislation here that is kind of insignificant. It's a lot of clarifying some language around when a renewal period might end, or some very specific attestation language that, unless, Ben, you have picked up anything on this, I find rather inconsequential in the larger picture of things.
Yeah, a lot of it's just mundane. It's the ordinary business of policymaking.
There are a couple of things that do seem to be rather beneficial to therapists, and some of the clarifying aspects of what they're doing is clarifying continuing education waivers that licensees are eligible for, which I largely support. And my only criticism with this aspect is that the proposed regulations specify that it's only for licensees. In California, the move from having to take a law and ethics test, and if you are not able to pass it, to take a 12-hour CE course on law and ethics, was replaced several years ago by taking 3 hours of CEs every single year. But it just strikes me as odd that if people fall under the disabilities or caretaking waivers that a licensee would, it's conceivable that pre-licensees would also have to do this.
Yeah, and I think it's a debatable question, right? About should pre-licensed folks, should registrants be eligible for a CE waiver if something like what you're talking about happens to them, circumstances beyond their control. My impression is that part of the consideration on the board level was that the continuing education burden overall is significant for licensees when you're talking about 36 total hours, whereas that requirement for pre-licensed folks is just 3 hours a year. That is a pretty darn light burden. And it also raises some questions if you start to apply CE waivers. Do those waivers mean that somebody could essentially get out of doing other licensure requirements that are often done by CE, so like the 3-hour telehealth requirement, 6 hours in suicide prevention? Are those things for which a waiver would apply or would not? It's probably cleanest just to say associates can't qualify for CE waivers, but it is a debatable question. And it's sort of the same question that's come up time and time again with the board about, you have 6 years to complete your hours of supervised experience. You have 6 hours for which a registration can be renewed. Is there some way, or should there be some way, to stop the clock? And the board has consistently said no, creating a way to stop the clock would be really too messy. They're working on a proposal now that would make those 6-year rules into 7-year rules instead, but still with no way to stop the clock. So how do you account for disability, deployment, other circumstances beyond somebody's control? What the board has chosen to do so far is try to keep their rules really clear and consistent. But then there's this waiver for CE for licensees, which does at least open the possibility of a pathway of saying, no, we understand this other stuff happens in your life. Why they would do that there and not necessarily in other places is a reasonable question.
Simple Practice's new AI-powered note taker records my sessions and then turns them into structured progress notes in just minutes, which means I can wrap up my day without spending my evening writing notes.
And for a limited time, Simple Practice is giving you a 45-day free trial of Note Taker. That's an extra 15 days when you sign up before January 16th, 2026. Get your hours back with AI-powered progress notes that generate key session takeaways just minutes after your session ends. Note Taker helps you remain HIPAA compliant, safely generate notes without compromising on HIPAA compliance or data security. Keep quality notes without typing, record your post-session reflections and turn them into structured progress notes. Stay prepared for every session. Quickly review key points before appointments, making it easy to pick up where you left off. And level up your documentation and reclaim your time with AI-powered Note Taker. Plus, get a 45-day free trial when you sign up by January 16th.
Everything I need is in one place, and it just works. No wonder more than 225,000 practitioners trust Simple Practice as their preferred EHR. You can see why at simplepractice.com. Is the opportunity to waive CE, is that new for licensees in this proposal, or is this something that's been available all along or for a very long time?
There have been ways for people to apply for continuing education waivers in the past, and this seems to expand those opportunities, which I'm in generally support of. That I think that there are life events that tend to happen, and in particular, what these proposals are talking about is in the event of a disability that can include either physical or mental health that would take somebody outside of their work. And it does require certain documentation that I think is supportive of life events do happen for people, and it shouldn't necessarily end up being something that hinders their ability to remain as a professional once that disability no longer interferes with their ability to work. So, in general, I support this. My only real consideration on this is that it limits it just to licensees and does not extend some of the same considerations to pre-licensees.
Yeah, I don't have a bee in my bonnet, so to speak, about this, but it is an interesting point that you raise about should it be consistent to associates as well as licensed folks.
Now, where the bees really exist, we've got a whole hive of bees coming up. This is the important piece of things that in some pre-discussion with Ben, I will give him credit for. The BBS is proposing that there are things that people should do as far as being involved in their profession, ways of enticing people to become more involved. And Ben used the words professional development activities. And the board is suggesting that many of these professional development activities could now be credited for continuing education hours towards someone's renewal period. Now, a lot of these have existed for some time. I've earned some of these continuing education credits by being a subject matter expert in creating the California law and ethics and clinical exams. That's going and spending several hours on days on end going through lots of books and writing questions crafted for what should beginning level people have to take on their licensure exam. I can attest that at some of those workshops, that is some of the most that I have ever learned about theories that I don't implement in my day-to-day practice. And I do believe that those kinds of activities are good professional development that does require learning. Katie and I both earn continuing education by serving on the California Association of Marriage and Family Therapists Ethics Board. And that is a lot of application around how do the ethics codes apply to people. Those things have existed and are good actual learning activities because we are engaging with material and actively using it. However, some of the suggestions that are in this proposal, I'm having a harder time with. We have episodes in the past, and we'll include links to them in our show notes about continuing education not really being beneficial in its current setup. But I have some problems with some of the recommendations here, such as attending a licensing board, the California Board of Behavioral Sciences meeting. Just attending it live or online counts as an hour for hour continuing education, up to 6 hours each renewal cycle.
I have mixed feelings about that. I know the board's wanting to get more people engaged in the process. You know, the joke that I and others sometimes tell about those board meetings is that it's really the same 5 jerks who show up to each one. I'm one of the jerks. But it's usually like me and a handful of other representatives from the professional associations. And everybody's doing good, diligent work. But there are 100 and some odd thousand clinicians under BBS jurisdiction. And the BBS makes a very compelling argument that it's not always in the best interest of well-informed decision-making that they are always hearing from the same quite small handful of voices. They want more people in attendance. They want more people participating, expressing public comment, asking for items to be added to the agenda. They know that that adds to their workload, but hopefully it makes them more informed. So this was a way that they came up with of encouraging, in a tangible way, people to attend their meetings. And they make the case that attendance in and of itself is educational in nature because you're going to have to keep up with what the board is doing in terms of laws and regulations. And even some of the other kind of board meeting or committee meeting activities that are not directly about crafting new law, that still is very informative in nature. I agree with that. There's a lot to engage with at board meetings. It is not structured education. It's not designed to be educational in nature, but it probably does have a meaningful educational benefit.
If you participate, if you just go and sign your name and stare at the screen, there's no accountability. A virtual CE requires some sort of a test. I'm assuming they're not creating tests at the end of board meetings. And the other part that I'm not clear on is, how did they come up with 6 hours? Do we know that? Because that seems like a lot for, I mean, that's a day, and so people just go and hang out in Sacramento for a day and get 6 CEs. But I think there's that element of how much CE you can get for going and just sitting and passively learning, potentially learning, or
Learning by osmosis.
by osmosis.
Well, let me address both parts of that, because the first question is there some kind of accountability? No, they're not going to create a quiz for that particular board meeting. And there is at least that minimal level of accountability now for structured learning activities that you might do through a CE provider.
Yeah.
So the fact that there's not that accountability, yeah, that does kind of beg the question, could somebody just stare at their screen all day and get credit for that in a way that they really can't through even asynchronous CE stuff?
Yeah.
But the other part is, how did they come up with that number? And for about 3 years, I worked for Simple Practice, one of your sponsors, good company. I was the director of Simple Practice Learning. And in that role, I was tasked with, among other things, figuring out or tracking the CE requirements in various states around the country. And listen, there are no villains here. Like there aren't bad actors. Nobody's being nefarious about this. But states land in interestingly different places about how many hours you need of continuing education, how they categorize those hours, what's acceptable, what's not acceptable, what particular pieces of education are going to be mandated as CE. And by and large, this is not data-driven decision-making that we are talking about. This is boards, and again, doing their best with their best judgment with the information that's available to them. This is boards making arbitrary decisions about what should count, what the category should be, how much should count here and there. And so you see these differences all over the country about how much CE you need as a licensed mental health professional. Maybe it's 18 hours here, 36 there, 35 there, 30 there. There's no good reason for those differences. It's just a difference. They put the lines in different places. You see differences in categories of hours, content that's required, what's allowed to be asynchronous versus not. Do you need to take courses through an approved provider? All of these things, there's not good hard data to say this policy is better than that one. And so what you see boards doing is kind of making their best guesses and best estimates. And again, not out of a nefarious place, but 6 hours is as good a line as any. They feel like, well, we want to give credit for this, but not too much. So I don't know, 6. And that's how you wind up with those numbers.
Part of this proposal also is licensees who are supervisors can potentially count up to 18 hours of continuing education by merely supervising. And by the bare minimum of needing to document that they have created supervision. But the rationale here is that supervisors are needing to be aware of what's going on in the world, and by being around supervisees are therefore engaging in continuing education related content. Seems to be the rationale on this.
We were talking about this, or this was a subject of discussion at a BBS meeting. I tried gently to raise the point that, yes, supervision can be very educational. I learn a lot from my supervisees. A lot of supervisors learn a lot from their supervisees. And good supervisors, when presented with a question that they can't answer, might help in going and doing the research. Or even if they assign a supervisee to go research on that question and come back to supervision, the supervisor is still learning from that. Like, that's great. That's a good supervisory process that does genuinely result in the supervisor learning. But is that inherent to supervision? Is every supervisor's supervision automatically educational for the supervisor? And there, I think the answer is no. And I think it's actually a really important question because it's a question about, frankly, the pretense. Is this truly an education requirement? Is the intent for us to be learning through these activities for which we get CE credit? Or is it really just a mechanism for the board to reward certain behaviors that they want to reward? And let me be clear. If it's just a reward mechanism, that's fine. I actually don't have a beef with that. But call it that. Don't keep up the pretense that this is an educational requirement. And where I get most worked up about this is actually not something that's new. Like the supervision issue is an issue, but something that they put in a few years ago where you can get, I think it's up to 6 hours of CE credit for responding to an occupational analysis survey. There is no reasonable argument that responding to a survey about what you do in practice educates you. Just none. You cannot keep up the pretense there. And again, it's fine if you want to reward that. I get that they want to increase response rates on that survey. That's actually a good, reasonable goal. And maybe the CE stuff is the best mechanism to achieve that goal. But it feels like blowing smoke if this board or any board is then saying, no, but it's an education requirement. Like, that's not education. Like, call it something else. Call it professional development. Call it some other thing that makes clear that we're done with the pretense here, and we are just going to use this as a method of rewarding certain board desired behaviors.
When I get worried with even rewarding those behaviors, especially at that level, it's 18 hours, 16 hours. What's the supervisors? 18. Having 18 hours for supervisors to just get CE for doing supervision with chess. We need supervisors. We need to have that happen. And then it sounds like it's, from our conversations before we hit record, it sounds like it's not clear, although I think the board's intent is not to have that count as supervision CEs. They still need to take 6 hours of renewal period. So there's still, they need 6 hours of supervision, 6 hours of law and ethics. And if they teach, then they've got another segment of hours that are counted if they're a professor or whatever. And it seems like there is very little space to actually ensure that supervisors are adequately trained. And I got to tell you, I've seen a lot of really bad supervision happen in my my time where boundaries were crossed, which I guess you would cover in a law and ethics exam, but old information, not staying up with new models, not understanding new methods of even supervising. Like, there's so much bad supervision that can happen. And a lot of our listeners are potentially private practice, group practice owners if they're supervisors, and they're not necessarily reflecting on what this can look like in community mental health, where supervisors don't have any moment to breathe. They probably have their own caseload. They have, probably 10, 15 supervisees. They're doing 2 group supervisions. They're doing all these things. They will want to get out of those continuing education responsibilities and potentially learn other things. Like, I'm not saying all of them don't want to learn. And it can feel decadent to get any additional continuing education because you just don't have the time.
Mm-hmm.
And so it seems really short-sighted to say half of your continuing education can be just doing your job. And then if you do other stuff, you may not have to get any real continuing education.
Yeah, and
It's
I think
scary.
You raised some really good points there, and I think about employers in community mental health, public mental health, at nonprofit kind of settings, where as things are right now, because of the CE requirement to renew one's license, those employers, if they're being responsible, and I think most are, they have to give their supervisors time to take courses, to engage in training activities, to do the things they need to do to meet the renewal requirement. And employers would love the idea that supervisors can get CE credit just for supervising, because then that's less time that I need to give the supervisors at my workplace to go do external trainings and things. I think that that's great for the employer, and for a lot of supervisors. Supervisors aren't going to turn down free CE credit. I certainly wouldn't. It's just sort of like handing out candy. And I think the underlying goal that has been expressed of, well, we need more supervisors. This is a way of encouraging people to become supervisors. I think that that's certainly great intent. What I haven't seen is any evidence at all that this would actually move the needle. Would somebody who is otherwise on the fence about supervising make the choice to become a supervisor because now they get CE credit for doing so? I just don't see a lot of people where that sways their decision. The motivations that people have for supervising or not supervising, I don't think they are so easily moved from one bucket to the other. And I was talking with my wife, Angela, this morning. You both know her. She's been on the show before. Brilliant MFT. And I was talking about this very thing, the CE credit for supervising. And I think I'm quoting directly that her response was, "Oh my gosh, that's the dumbest thing I've ever heard. And I will definitely take them up on that." And I think that's what you're going to hear from a lot of supervisors is, that's weird, but okay. Right?
Yeah.
Is it really going to achieve this goal of having more people supervise? Or is it mostly going to have the effect of supervisors doing less education? I really think it's going to be more the latter.
Well, and if it does increase the number of supervisors, it's kind of like saying, I need a garden, and then you just start planting weeds. I think it's something where having some mechanism to make sure that supervisors are getting adequate, robust education and potentially codifying that, I think is really important, because I don't know how many times I've heard about bad supervisors, and that's why someone doesn't make it through to licensure, or that's why someone is harmed in some way. And I get very concerned if we're saying, you're a supervisor, so you got it. We'll get you half your CEs just for showing up to work. That seems really concerning to me.
I hear that. And I do respect the difficulty of the debate at the BBS level, where they know that for a lot of folks who struggle to reach licensure, they struggle at least in part because it's hard for them to find a qualified supervisor.
Sure.
And so the BBS is thinking, well, what mechanisms do we have at our disposal to encourage people to become supervisors and to remain supervisors, so that there's as much supervision as possible that is available to help people under supervision get their hours done. I get that it's a really difficult balance if you're sitting on the board between wanting to encourage people to become supervisors and still wanting to maintain some minimum standard for the quality of supervision. So again, I don't want this to be heard as like demonizing the board or anybody on it. Like I get the difficulty of the choices that they are making. I land in different places on some of these.
I want to emphasize the point that Katie also mentioned here, is that it is entirely possible, if this legislation goes through, that somebody could accrue all of their CE requirements without actually having to take any traditional CE courses. Now, again, I know that the continuing education system is, I'm no fan of it, but to provide even more outlets for people to be able to not have to engage in any kind of active learning is really, really hard sell to me on this actually being something for public protection.
Yeah, I hear that. And, I'm an educator and a supervisor myself. So if I can get 18 hours from the classes that I am teaching and 18 hours for being a supervisor, hey, there's 36. Good for me. Is it really in the best interests, either of me or of the profession as a whole, for me to not be getting educated from more external kinds of voices? I don't know that that's in my best interest or in the profession's best interests. I think that's a real concern. If you start awarding so many of these other behaviors, then you are sort of definitionally reducing the amount of structured education that people are going to be doing. And you guys have talked before, I've talked before about how there are real limits to the benefits of continuing education as it's currently structured. But I don't know of really anybody seriously making the argument that continuing education as a concept shouldn't exist. I think there's agreement in the field that we need to stay current. We understand that the laws and ethics governing our work change, that the models people are using in practice, those change over time. The science certainly continually advances, and we need to have a way of staying current. And we can debate what the best way of doing that is, certainly, but I think that there's no real disagreement that we should do that. And so how do you sort of ensure that you're providing credit for these other desired activities, but also keeping somebody current on what's happening in the profession? This is where we get into those arbitrary decisions that happen differently from one state to another. I actually really like as a model what Colorado does for their master's level folks, where you have to actually come up with a learning plan that's based on a self-assessment of what you are current on right now and any potential gaps in your knowledge that you would like to address in the current license renewal cycle. And then you go about engaging in activities designed to meet the goals of the learning plan that you have developed. It really forces a thoughtful process. And there are all kinds of different activities that Colorado will count toward your continuing professional development requirement. And that's good. It's good to have flexibility in learning processes. But it avoids, in I think a really good, thoughtful way, what happens in California and some other states, the way things are structured now, where somebody gets a week before their renewal date, they have that oh crap moment, and then they try to do 36 hours of CE credit in 5 days and cobble together whatever credit they can from stuff they've already done. I think that's just a better model, and it also does conceptualize it as professional development as opposed to a quote-unquote education requirement that isn't really totally about education.
Maybe one of the things that boards could do instead of just tossing out CE certificates or professional development credit towards CE is if a board has a budget surplus, they could just use engagement in those activities for fee reductions. And
hypothetically.
hypothetically, if you're looking for more engagement, and oh, by the way, California's BBS has this problem where they have too much money. And
I know, rough problem to have.
And they are implementing this. This is something that I don't think can be much influenced at this point. But Ben, you are much more familiar with what California is doing in this process. And we'll spend our last couple of minutes here talking about how this is the dumbest way possible of handling having too much money.
Well, sure. So I know it's rough, right? You've got too much money. What are you going to possibly do with all this extra money that you have? A few years ago, the BBS raised a whole bunch of their fees, and that was understood at the time as a way of helping to support their automation of various processes, which they have been making progress on, and also a way of allowing them to hire more staff, which they have been continuing to do as well. Even so, hiring at the state level is difficult for a whole bunch of bureaucratic reasons. And the board has been taking in these higher fees, which still, by the way, are kind of a bargain compared to a lot of states around the country. But the board now has too much money. There are state guidelines about how much money any licensing board should have in its reserves. The general fund pulled a $10 million loan from the BBS fund not too long ago, but the BBS still has too much money. So in order to stay in sort of the good graces of the state, the BBS has to find a way to spend down some of this reserve. They're not going to be able to do it all quickly enough through additional hiring, through additional automation, etc. To be clear, they are continuing to work on those things, and they will continue to work on those things, but they can only move so quickly. So what they have proposed is beginning on July 1st of 2026, for 4 years, all BBS fees would be cut in half. It would be a 50% fee reduction. And they chose 4 years because they did some financial modeling about how much this would cost them, and also because that was a way of being fair to people based on different, renewal dates. 4 years is 2 license renewal cycles for all licensees. So that's a way of kind of covering everybody equally.
If I'm a listener right now, I'm thinking, that is amazing. Go on. Go on.
Right? No one is going to complain about this. Everybody is going to be happy about paying less money to the licensing board. I get it. I'll be happy about that too. I write a renewal check just like everybody else. So having a fee reduction is a good thing. Should clarify, the fee reduction applies to BBS fees. So the fees that you pay to take a national exam, those are unchanged because those are not set by the BBS. That being said, there are other ways that they could have approached this. And I personally was advocating for a little more of a nuanced approach where they would have further reduced or maybe even entirely eliminated some of the fees for people early in their career. So initial registration fee, registration renewal fee, initial licensure fee. I'm somebody who is licensed, and while I certainly don't like paying a renewal fee any more than anybody else does, licensees in general, or on average, are probably a little bit better positioned to pay the fees that we are paying without it creating severe financial hardship. I think the fees create severe financial hardship more often at those early career levels. So I would have been fine with keeping the renewal fee for licensees close to what it is now, maybe knock it off a little bit, and then eliminate those fees entirely for people at lower levels. But that was pretty quickly dismissed as an option. At a board meeting, they said, no, we want to go with 50%. That's cleanest. Let's just do that. And so that's how it's moving forward. Again, nobody's going to complain about paying less, but I do think there would have been a better way to do it.
And I'm calling now on July 1st, 2030. There will be lots of complaints about the board raising fees out of nowhere, doubling overnight. Dan, I want to thank you for spending your time and your knowledge and all of the incredible advocacy work that you do engaging in this licensing process. You're a wealth of information. Where can people find out about the work that you're doing? How can people support you and the businesses that you are operating?
It's always a pleasure talking with you both. Thanks again for the invitation. You can find me and my work at highpass.com. That's highpass.com.
And we will include a link in our show notes over at mtsgpodcast.com. And follow us on our social media, join our Facebook group, the Modern Therapist group, to continue on with this and other conversations. I will be writing up my letter to the board, bringing up some of these points as well. If that's a starting off point for you, we'll make it available through some of our outreach places. And until next time, I'm Curt Widhelm with Katie Bernoy and Dr. Ben Caldwell.
If you're tired of juggling a dozen different tools, Simple Practice is your one-and-done EHR solution. Over 225,000 practitioners are already simplifying their workflow and saving hours daily. You could be too. Learn more at simplepractice.com.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.